And now to the coronavirus outbreak and the new case tonight in California that is especially concerning.
The CDC has confirmed this is the first case in the country with no link to travel abroad and that the origin of the patient's exposure is unknown. And with Brazil reporting its first case today, the virus is now on every continent except Antarctica.
And there are more than 81,000 cases now worldwide, more than 2,700 deaths. And right now there are 58 confirmed cases in the U.S.
That said, there are no confirmed cases here in the tri-state, but some who may have been exposed are in self-quarantine. 8 of them in Westchester, 29 in Suffolk County, and 83 in Nassau.
And that is where CBS News' Jessica Layton joins us live with more on the precautions being taken in the area tonight. Jessica.
Christina Maurice, of those 83 people you just mentioned here in Nassau County, only 1 is said to be showing any symptoms. Still, hospitals across the tri-state have been preparing for possible patients of coronavirus for several weeks now. And today, this one showed us how. Mount Sinai South showing us how it can convert some hospital rooms into isolation rooms with these double doors. Negative air pressure would help keep germs from spreading. And like hospitals around the country, they have stockpiled emergency supplies.
We've been preparing for this for decades, so this one is novel this year. We had Ebola a few years ago. We had H1N1.
We don't know exactly how many cases are going to come, but we do have plans in place.
As every county health department should, after the dire warning from the Centers for Disease Control this week that the spread of the virus is inevitable in the U.S. A warning that gave leaders across several cities and states the same idea Wednesday: assure the public we're prepared.
We're in a state of high vigilance, high readiness, all elements of the city government to address this crisis.
Mayor Bill de Blasio says if necessary, 1,200 hospital beds will be ready to treat affected patients. And the city has 1.5 million surgical masks on hand for healthcare providers and first responders.
For everyday New Yorkers, there's no need to use a mask.
In fact, the Health and Human Services Secretary says they could do more harm than good.
Because if it's not fitted right, you're going to fumble with it. You're going to be touching your face, which is the #1 way you're going to get disease, is unclean hands touching your face.
In Los Angeles, the city is working overtime to prevent the spread after it was confirmed that a Korean Air flight attendant who worked flights out of LA tested positive. In communities where the virus does spread, experts say there will likely be disruption to everyday lives.
That may include canceling mass gatherings, sporting events, having people work from home as much as possible.
Whatever happens, we're totally prepared.
Wednesday evening, President Trump tapped Vice President Pence to head up the country's coronavirus task force, downplaying the need to panic, but acknowledging the potential for more infections.
I think that there's a chance that it could get worse. There's a chance it could get fairly substantially worse.
The good news is most Americans who have the virus are said to be doing well. Some of them remain in isolation at this biocontainment facility in Nebraska.
I get a little better every single day. Still have a cough, but the cough's no worse than a cough I would have if I had a normal cold or the flu.
Now, that patient was asked about the treatment he's been getting there in isolation in that hospital in Nebraska. He said the only thing doctors have really given him is Gatorade. So hydration, obviously very important with coronavirus and really any virus, but also there is no vaccine yet. A vaccine to the public is at least a year away. We're live in Nassau County tonight. Jessica Layton, CBS 2 News.